Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam, also ESIC, AIIMS NORCET, DSSSB exam, and also Kerala PSC DME exam, Insurance Medical Service exam, and JPHN exam. In yesterday's video, we discussed questions from obstetrics and gynecology. Today, again we can see the continuous questions from OBG. And the first question, the amount of fetal blood flow per minute through the placenta at term is? Options, option A 100 to 200 ml, option B 200 to 300 ml, option C 300 to 400 ml, and option D 400 to 500 ml. Question, the amount of fetal blood flow per minute through the placenta at term. Okay. And the correct answer is option D, 400 to 500 ml. And the volume of blood in mature placenta is 500 ml. And fetal blood flow through the placenta is nearly 400 to 500 ml. And the next question, a nurse is performing an assessment of a pregnant client who is at 28th week of gestation. The nurse measures the fundal height in centimeters and expects the finding to be which one? Option A 22 centimeter, option B 30 centimeter, option C 36 centimeter, and option D 40 centimeter. Here, a nurse is measuring the fundal height of a pregnant woman who is at 20th week of gestation. What is the normal fundal height does the nurse can expect for this woman? Okay, so here the fundal height in centimeter, answer is in centimeter. Okay, so fundal height in centimeter approximately equal to fetal age. Here fetal age is 28th week of gestation. Fetal age in weeks plus or minus 2. Okay, here 28th week plus 2 or minus 2. In our option plus 2, 30 centimeter is there. So we can expect it is 30 centimeter. Once again I will tell, fundal height in centimeters approximately equal to fetal age in weeks plus or minus 2. Fundal height at various week, we can see at 16th week the fundus can be located halfway between the symphysis pubis and the umbilicus, and at 20 to 22 weeks the fundus can be located at the level of umbilicus, and at 36 weeks the fundus is at the level of xiphoid process. And the next question, after the birth, the umbilical vein collapses and forms. Options, option A ligamentum arteriosum, option B ligamentum venosum, option C ligamentum umbilicus, option D ligamentum teres. And the correct answer is option D ligamentum teres. After birth, the umbilical vein collapse and form ligamentum teres, and the ductus venosus become ligamentum venosum. And the next question, at 8th week, the uterus look like a? Options, option A small unripe pear, option B large orange, option C size of a grapefruit, option D a golf ball. At 8th week of gestation, the uterus look like an orange, large orange. Option B is the correct answer. At 8th week of gestation, it looked like a large orange uterus. And at 12th week of gestation, it looked like a grapefruit. And at 14th to 24th week, it looked like a size of papaya. And the next question, the sagittal sutures are lies between. Options, option A occipital bone and 2 parietal bone, option B parietal and frontal bone, option C 2 frontal bone, option D 2 parietal bone. The sagittal sutures are lies between 2 parietal bone. Option D is the correct answer. Sutures, we can see the sagittal sutures. It is also known as longitudinal sutures. It lies between 2 parietal bone. And the next one, the coronal sutures. It lies between parietal and the frontal bone. And the next is frontal suture. It lies between 2 frontal bone. And the next one, lambdoid suture, which separate the occipital bone and the two parietal bone. Here our question is, the sagittal sutures are lies between two parietal bone. And the next question, wide gap in the suture is known as options. Option A, diameter. Option B, circumference. Option C, fontanelles. Option D, inlets. The wide gap in the suture is known as fontanelles. Option C is the correct answer. Fontanelles are anterior fontanelle is also known as bregma, and posterior fontanelle it is also known as lambda. Anterior fontanelle is diamond shape and posterior fontanelle is triangular in shape. And the next question, extreme softening of the cervix during the first trimester of pregnancy is known as option. Option A, Chadwick sign. Option B, Osiander sign. Option C, Gould sign. Option D, Hoffman sign. Question is, extreme softening of the cervix during the first trimester of pregnancy is known as Gould sign. Option C is the correct answer, and it is commonly seen early as 6th week of pregnancy. First one, Chadwick sign means is a dusky huge vestibule and the anterior vaginal wall due to local vascular congestion. It is mainly seen at about 8th week of gestation. Osiander sign means there is an increased pulsation felt through the lateral fornix of the vagina is known as Osiander sign, and it is seen at early as 8th week of gestation. And the next question, Giacomo sign is also known as options. Option A, Chadwick sign. Option B, Osiander sign. Option C, Gould sign. Option D, Haga sign. A Giacomo sign is also known as Chadwick sign. Option A is the correct answer. Giacomo sign or Chadwick sign means is a dusky huge vestibule and anterior vaginal wall is due to localized vascular congestion. Is seen early as 8th week of gestation. And the next question, the causative organism of bacterial vaginosis is options. Option A, herpes simplex virus. Option B, Candida albicans. Option C, chlamydia trachomatis. Option D, Gardnerella vaginalis. Question, which is the causative organism of bacterial vaginosis? It is option D, Gardnerella vaginalis. Bacterial vaginosis means is an inflammation of the vagina and upper genital tract. It is caused by Gardnerella vaginalis. And the next question, the test used for the diagnosis of trichomoniasis is options. Option A, wet mount of vaginal fluid. Option B, ELISA test of serum. Option C, specific serological test. And option D, all of this. Question, which is the diagnostic test for trichomoniasis? And the correct answer is option A, wet mound of vaginal fluid. How will perform this test means small amount of vaginal discharge will take from the patient, and this vaginal discharge will put on a slide. 1 or 2 drops or few drops of saline will add on it. Then see under the microscope. Okay. And the next question, name the test where vaginal secretion is mixed with a drop of 10% potassium hydroxide on a slide, producing a characteristic stale fishy odor is option A, non-triponimal test. Option B, triponimal test. Option C, whiff test. Option D, serological test. Question is, in which test vaginal secretion is mixed with 10% potassium hydroxide on a slide and produce fishy odor is whiff test. Option C is the correct answer. In this test, the vaginal swab is mixed with 10% of potassium hydroxide. There will be a fishy odor. And the positive test means there is a bacterial vaginosis or bacterial vaginitis. Here option C is the correct answer, whiff test. Today again we discuss questions from OBG. Surely these questions will guide you for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle.